Historically, it is common that a percentage of wheelchair users will present some form of postural deviation and/or asymmetry. In some cases, it's a wide trunk and narrow hips. In other cases, it's the opposite. Sometimes the asymmetry is lateral instead of horizontal. These varying client presentations are a challenge for clinicians, ATPs, and technicians to accommodate using an off-the-shelf backrest. To solve this challenge, Jay has developed the CradleU, an innovative new attachable support system for the off-the-shelf J3 back. Rather than simply containing an asymmetry with traditional flat or offset laterals, which are sometimes difficult to position, interfere with propulsion, and can make the transfers more difficult, the CradleU mimics the natural contour of the back shell. The CradleU is positioned behind the back foam, so it actually reshapes the contour of the back to match the profile of the user. Let's take a closer look at how this works. To attach the CradleU support system, the cover assembly is removed and the CradleU is placed on the vertical Velcro strips that run down the center of the J3 back shell. Next, the support plates are loosened and positioned to match the profile of the user. Whether this profile is a narrow trunk and wide hips or a wide trunk and narrow hips, the supports can always be angled to match an upward taper or a downward taper. In the case of a slight vertical asymmetry, the entire assembly can be offset to accommodate the deviation. The plates are then tightened and the base cover assembly is reattached. The fit is assessed and readjusted if necessary. As the name suggests, the CradleU cradles the user in the same way a clinician or ATP would position them using their hands. It's secure, it's supportive, and it's intuitive. Just another great solution from the team at Jay. Our goal is always to provide superior clinical seating.